Bismillah ar-Rahman ar-Rahim. Dear colleagues, welcome to the onboarding webcast. This is a brief summary to provide an overview of projects conducted and completed by the finance workstream since year 2018. In addition to progress update, we will also look into the next round of projects which are essential to ensure continuing development of the transformation program of health clusters. I'm Kash Kamal and I will be your presenter today. Here's our agenda. We will start with historic positioning of financial transformation program within corporatization and model of care program, our high-level approach to change, completed and next stage projects. Corporatization and model of care program, also known as CMC, consisted of 6 main pillars known as work streams, namely eHealth, Program for Health Assurance and Purchasing or FAP, Private Sector Participation or PSP, Governance, Finance and Workforce. Each workstream was led by a dedicated management team who were responsible from initiation to the delivery of projects. Focusing on finance workstream, we manage projects in 3 distinct areas. Operational finance or administrative finance, such as financial reporting, financial management, and internal financial control for clusters and the health holding company. Second area of projects related to patient level costing, coding, and revenue cycle management. Third area of projects related to tangible fixed assets management, inventory, and financial valuation. We split the transformation journey into 5 distinct stages. The lines between are not hard and practically over the years lots of things have moved in parallel. Stage 1 comprised the understanding of ground realities by performing financial capability assessments of care providers as well as the regional offices of Ministry of Health. Stage 2 was about studying the best practices around the world and compilation of detailed operating models which are suitable for the Saudi market. Stage 3, this is the phase we are in at present and involves implementation and rollout of designs completed under Stage 2. In Stage 4, once cluster has completed the implementation of model and able to demonstrate capability to operate independently, the financial delegation of authorities will be enhanced and wider autonomy will be granted to make decisions and control resources independent of Ministry of Health. In the final Stage 5, the autonomous healthcare cluster will operate like an accountable care organization, ensuring that patients get the right care at the right time while avoiding unnecessary duplication of services, cost, and preventing medical errors. In Stage 1, we went out to medical cities such as King Saud Medical City, Riyadh, King Fahad Medical City, Riyadh, King Fahad Specialist Hospital, Dammam, and King Abdullah Medical City, Makkah. We also visited a wide range of self-operating hospitals, non-self-operating hospitals, and 17 regional health directorate offices of Ministry of Health. Each entity went through detailed financial assessment covering current management and control systems, processes, and dependencies on Ministry of Health. The capability reviews became an input to new operating model design and very clearly highlighted gaps in skills, systems, and processes. On this slide, I will go over the projects we have completed. Budgeting, it is important to note that current budgets from Ministry of Finance or Ministry of Health are not provided on a cluster-by-cluster basis. In the first instance, we had to determine a carve-out methodology or basis of cost allocation to draw a cluster-specific budget. The results of this exercise were mixed in terms of accuracy, but provided useful model for future adaptation and refinement. Finance Center of Excellence, different people define Center of Excellence differently and often confuse Center of Excellence or expertise with shared services. We initially designed COE-like panel of experts advising the cluster CFOs and members of the board on specialist finance issues. Down the line and with better understanding, we realized that CFOs and clusters needed a lot more hands-on support and training for the team instead of specialist advice. Therefore, we redefined the scope and redesigned the entire model to cater for these needs. In the current design, the COE gets strongly involved in team development and training, and with over time becomes a specialist advisory arm. The procurement document or request for proposal to mobilize the Center of Excellence has been completed in 2019 and currently undergoing the procurement process. The detailed operating models, including org structures, policies, processes, workflows for both holding company and the clusters have also been completed. Asset management model project was one of the most complex and detailed project we undertook and completed. The project was extremely demanding due to a wider range of stakeholder engagement. We worked for over 2.5 years with Ministry of Finance, National Center of Privatization, Purchasing and Health Assurance Program, Real Estate General Authority, Health Holding Company, Clusters and Ministry of Health Finance teams. In December 2019, we successfully issued a system-wide capital manual. The manual goes into great length of detail and cover the key areas such as establishment of asset performance, reporting and KPI systems, data collection, validation and submission processes, data processing and dissemination processes, performance evaluations, and capital budgeting and approval processes. Statutory reporting framework, there has been extensive discussion around this particular topic as to should we use IFRS or IPSAS. We undertook a detailed project comparing IFRS with IPSAS to assess the reasonableness and relevance of each to Ministry of Health and Clusters. After comprehensive assessment and in collaboration with Ministry of Finance, IPSAS was selected for short to medium term with option to adopt IFRS in the longer term. Once the statutory reporting framework was signed off, we designed a unified chart of accounts to cater the reporting requirements under IPSAS, Ministry of Finance and the Management Information System. Subsequently, detailed accounting policies were also compiled and issued. Under the Finance Enterprise Resource Planning project, we looked into different vendors such as Oracle and SAP and the suitability of the technology platforms for the new operating model. After detailed review along with cost and benefit analysis, we decided to proceed with Oracle. The technical BRD or business requirement document has also been completed and now ready for detailed design and implementation. The capability assessments and detailed operating model designs help pave the way for structured implementation. Working alongside the cluster CFOs, we started a training and development project covering a range of topics such as new finance operating model, financial delegation of authorities, cash and accrual basis of accounting, compilation of financial statements in line with IPSAS, management reporting for operational controls, planning and budgeting, as well as chart of accounts. It is important to note the skill gaps in the system are quite wide. What we achieved was the first phase of training, and there remains a dire need for ongoing and comprehensive staff development programs. The asset inventory project for Eastern Cluster 1 and Central Cluster 2 are currently ongoing and are due for completion during year 2020. Upon the completion of these projects, the clusters will have full understanding of the asset capital value within their cluster, detailed asset registers, and ability to maintain the new additions and disposals. Building on the success of the past 3 years, the next round of projects will comprise of the following: asset inventory for 2 new clusters, system-wide capital manual refinement and implementation, the continuation of operating models implementation at the health holding company and clusters, operationalization of Finance Center of Excellence, step-by-step transfer of financial authorities to cluster boards, the implementation of unified enterprise resource planning system, compilation of short to medium term capital plans to support the new model of care, and detailed spending review to identify savings to support continuing investments in the transformation program. Towards the end, I would specifically like to acknowledge the support we receive from our consulting partners and their teams: Rob Hucknall, partner PwC, Ian Baxter, partner PwC, Thomas Corvilla, partner ADL, Vikas Karbanda, partner ADL, Matthew Gunby, partner EY, and Fadil Bhairan, partner EY. I would also like to thank Mr. Ali Al-Lafi, Mr. Nasir Al-Khalevi, Dr. Muhammad Al-Saghir, and Dr. Umar Al-Shankiti for their continuing guidance and exemplary leadership. If you require any further information, please feel free to reach out to us. I can be contacted on 055 224 9900 in Saudi or kkamal, KKAMAL at moh.gov.sa. Thank you.